Texas. Michael Burgess sits on the House Energy and Commerce Committee. Congressman, it's good to see you. Now, while they may not all live in your district, what do you say to the president's criticism that by not opting to expand Medicaid at least, not opting to expand Medicaid, 1 million people who could have insurance in Texas do not?
Well, let's get a couple of things out there at first. Medicaid will continue to exist in Texas as it has. So for blind and disabled, certain pregnant women, that coverage does not change with or without the Affordable Care Act. 25% of the state budget right now is spent on Medicaid. I think Governor Perry was wise in his decision to say not so fast. Look, when the Supreme Court changed the equation on Medicaid expansion...
Congressman, before we get to that, I want to go back to what you just said, because I think it's important here, especially for our viewers who are watching and listening, to understand that there are 6 million people who don't have insurance in Texas alone. And by expanding Medicaid in that state, 1 million people would have insurance. And here's the other part of this. Folks in Texas who pay federal income taxes like they're supposed to, they're paying for the service anyway. Why not take advantage of it? Why not let Uncle Sam shoulder some of the cost of health care in that state?
Well, let's look at this rationally. When the Supreme Court said that the federal government cannot coerce the states to expand their Medicaid programs, it gave Texas an opportunity. Let's see what happens in other states that are expanding their Medicaid.
How is that rational?
It's absolutely rational. How is it rational to expand a broken program? I mean, why in the world, if you were going to reform health care in this country from soup to nuts, would you expand Medicaid? Any doctor in Texas will tell you right now, Medicaid reimburses between 25 and 33% of the cost of delivering the care. You can't keep your practice open by seeing Medicaid patients, and that is one of the sad truths. I think Governor Perry was exactly right. Let's see what happens in other states. Let's let other states have an experience with this before we move forward. And look, the broader issue
what happens to the millions who are uninsured in Texas while we wait for that? While we wait for this.
The reality is there's supposed to be a federal exchange that starts up. I have not yet successfully been able to access that myself, but whenever the problems are solved with the website, that will happen. Because of the way the law is written, anyone down to 100% of the federal poverty level will be able to access a subsidy in the exchange. So there is an option that already exists. But, you know, the website itself is just a symptom. It's just a symptom of a larger problem. It's like when I was in practice, someone said, I've got a fever, doctor. Well, that's just a symptom. You've got to find out why they have a fever. The problem is this law was so flawed right from the get-go. I don't think it was ever intended to work.
Congressman, let's disconnect the two, because what you just said doesn't make a great deal of sense. Even if the law was flawed, which is your argument, how is that in any way connected to the website itself?
Fatally flawed.
So how is that connected to a functioning website?
Well, look, Craig, you start with an incompetent group of people trying to craft major public policy done as a partisan exercise, and now is it any wonder 3.5 years later that they weren't able to get this right? What else are they going to get wrong?
So because the law was bad, incompetent people... I wish we had more time, Congressman Michael Burgess.
Well, what do you have to do to get fired by this administration? What does it take? What degree of incompetence must you exhibit in order to be fired by Barack Obama? That's what people are asking me today.
Republican from Texas. Congressman, I want to have you back when we have more time.
Anytime.
Thank you. I'm going to hold you to it. Thank you so much.
Anytime.